So I've been experiencing male pattern hair loss for the past 8 years. At the young age of 20, I realized that my hair is already thinning. Tried various methods of trying to cover up my already thinning head of hair. So things like various hairstyles like comb overs. But after a while, I realized that I was not able to cover up as the hair loss was actually worsening. And to be honest, I took a leap of faith and actually decided to spot the shaven head. And it turned out quite well. My mom says they are quite a nice head shape, so I guess that's a good thing. But of course, there are more benefits other than the cosmetic. Yes. So I'd like to just touch a bit more on the cosmetic benefits. So having a full head of hair will allow someone to look younger, especially for me. My patients say that, oh, I look, well, uncle, you look 35, 40. I wouldn't blame them, because my hair is really like that. But yeah, so it allows someone to look younger. Number two, it probably allows someone to, at least allow me to play with different kind of hairstyles, and use like hair styling products and things like that. Change out your outfit certain times, So other than the cosmetic benefits, my friends would know because I'm an avid diver. Every time I go for a dive trip, I'll come back with severe sunburns on my scalp. And it's not a good feeling to have peeling scalp, especially when you go to work and you have to look presentable. But yeah, having a head of hair will actually prevent you from getting sunburn, and in the long run, will actually prevent you from getting skin cancer as well. So I'm currently 28, going to 29. I started experiencing hair loss at the age of 20. Back then, I was probably in year 1 or year 2 of medical school. And you can imagine as a fresh university student, whilst all your friends are sporting a full head of hair and you are experiencing hair loss, it took quite a big hit on my self-esteem. Given that at that point in time I was still single and fresh in the dating scene, probably had a bit of an impact on me as well. Because I couldn't pull off various hairstyles, and most of my studying had to a big focus on trying to cover up the bald spots. So you can imagine at that age, it's probably quite a big issue to me. So I think the most important factor is actually genetics. My dad also experienced hair loss, but probably at a much later age. But for me, one of the biggest issues I probably would attribute it to stress from medical school. So at the age of 20, I was already ongoing towards my clinical phase. At that point in time, I gymed a lot as well to cope with the ongoing stress, and I realized that that actually precipitated or at least exacerbated my hair loss at that point in time. So the procedure has been great. So far I've minimal to no pain, and in fact I kind of slept through the entire procedure. Yeah, so initially the only discomfort was when the LA was given, and subsequently I couldn't feel anything at all. So currently we are done with harvesting of the grafts, and I just had my lunch actually, waiting to start the second part of the surgery. Yeah. I have been in the operating room numerous times and assisting in various procedures, and being on a patient's end actually gave me a real big eye opener. In actual fact, I felt really anxious for today's procedure as well, but I was able to pick up the areas or the procedures that were a bit more nerve-wracking, such as the injection points and things like that. And I really get the experience in the patient's shoes, the entire procedure, hair transplant journey. So I think this experience that I have will take me a long way when I bring a higher level of standards of patient care to my patients, because I know how it feels like, the anxiety involved, as well as the nerve wracking parts and things like that. Yeah. The initial anxiety phase is over, but now I'm having a new wave of anxiety, because I know that post-op care is actually very important to ensure that there's an adequate graft survival. Dr. Joshua did an amazing job, and so now the ball's in my court. I know that I'll be undergoing a vigorous regime of saline spray on the graft region, as well as creams, and I'll be coming back multiple times for post-op reviews, and the full effect of the transplant will only be visible about 6 to 12 months. Yeah, and I can't wait to see what's in store for me.
Alright, JC, take care. See you tomorrow.
Thanks so much.
Okay, so the time now is 7 p.m. It was a long day. The surgery went pretty well. He was a very good patient. I think even though this is bread and butter for us, doing a surgery on a fellow doctor, fellow medical practitioner, is always that little bit more stressful. You know, it's like a Michelin star chef cooking for another Michelin star chef. But we'll be seeing him tomorrow for a review, and I hope he'll be recovering well. We'll catch you guys tomorrow.